This is Stephanie Huff, and this is a recording of the concept of fluid and electrolytes. First, we're going to start off talking about IV fluids. The purpose of giving IV fluids are two purposes. One is for maintenance when oral intake is not adequate, and the second is for replacement when fluid losses have occurred. Looking at different types of fluids, you have hypotonic fluids. In hypotonic fluids, the osmolarity is greater than the normal body fluids, and so this shifts the fluid from the intravascular space into the cells, and so it hydrates the cells. Uses are for low sodium levels or to expand and hydrate the cells. It is not used with low blood pressure because it can drive the blood pressure even lower because it's pulling that fluid out of the intravascular space. It can cause cardiovascular collapse and increased intracranial pressure. It is also not used for treatment of a head injury, trauma, neurosurgery, or burns. Examples of hypotonic fluids are half normal saline and a third normal saline. Looking at isotonic fluids, the osmolarity is equal to that of the body fluid, so there is no fluid shifts taking place. It is the same concentration of body fluids, and so it expands the IV compartment only. So it expands that extracellular space and keeps fluid in the intravascular system. Uses are for dehydration and fluid maintenance. Examples are normal saline, lactated ringers, and D5W. D5W is isotonic in the bag but becomes hypotonic in the veins because the glucose is rapidly metabolized, leaving free water only. You have to watch for fluid volume overload in isotonic fluids.
Intravenous saline solution consists of sodium chloride dissolved in water. Because its osmolality is similar to that of blood, it is commonly administered to support circulating volume, as shown here. It can correct or prevent dehydration and support blood pressure.
All right, hypertonic IV fluids. In these type of fluids, the osmolarity is greater than the body fluids, and so it draws fluid out of the cells back into the circulating volume, which is in the veins. It also restores that circulating volume and can increase calories. So because it can increase intravascular fluid volumes to excess, you need to watch out for wet breath sounds, which would be crackles, increased blood pressure, and fluctuation of serum sodium levels. Uses are hypovolemia and hyponatremia. Examples of this type are D5 normal saline, D5 lactated ringers, 3% normal saline, D5.5 normal saline, and TPN, which is your total parental nutrition. All right, so the concept of fluid and electrolytes, the body is composed of these many fluids that are required for homeostasis, and this is the main fluids that are found in the body, but not all of them, but these are the main ones that you will see, and it goes from the blood all the way down to the cerebral spinal fluid, as you can see. Homeostasis is the state of equilibrium in the body. It is important to maintain equilibrium, which is homeostasis of fluids and electrolytes, so the body can function normally. This is naturally maintained by adaptive responses in the body. Body fluids and electrolytes are maintained within a narrow limit within the body. The maintenance of electrolyte homeostasis is controlled by dietary intake and kidney output. All right, electrolytes are charged ions capable of conducting electricity. And so within all of your body fluids, that's where your electrolytes are contained. Your fluid and electrolyte balance is crucial in maintaining health. Homeostasis depends on multiple physiologic processes. Imbalances can result from a variety of conditions. They can affect chronic and acute illnesses. And these chronic and acute illnesses can create these imbalances. So some of your conditions, acute could be dehydration, chronic could be renal failure. Even the processes of daily living, such as excessive temperatures or vigorous activity, can disturb balance if adequate water and electrolytes are not maintained. Looking at the fluids in the body, 60% of a healthy adult's weight is water. So water is the primary bodily fluid. Water is necessary for normal cellular function. It is a medium for metabolic reactions. It helps transport nutrients and waste products. It acts as a lubricant, insulator, and shock absorber. And it also helps to regulate, maintain body temperature. All right. So the percentage of body weight that is composed of water is generally greater in men than women because men tend to have more lean body mass than women. And fat cells contain less water than lean tissue, so thin people have more water than your more obese people. Also, the older you get, the less water content we have. So you can see 60% about is the body weight of adult is water. 45 to 55 in older adults, 70 to 80% in infants, and this also varies with gender, body mass, and age. And so here's just another picture, just kind of showing you the different concentration of water in each stage of the body. So we can see that children have a lot more water content, elderly have a lot less. So they are both at higher risk for fluid-related problems than your average young adult. All right, looking at the distribution and components of body fluids, you have your intracellular and your extracellular, which are the two major compartments that the body's fluid is divided into. Your intracellular are found within the cells of the body. And so this contains your solutes, which are substances that dissolve in liquid, like oxygen, electrolytes, and glucose. They provide a medium in which metabolic processes in the cell take place. Your cations are positively charged ions, like potassium and magnesium are the major cations in intracellular fluids. Your anions are negatively charged ions, and phosphate and sulfate are the major anions in intracellular fluid. Your extracellular fluid, this is found outside the cells. There are two major compartments of extracellular, and that is intravascular and interstitial. Other compartments are lymph and transcellular, which includes your cerebral spinal fluid, pericardial fluid, pancreatic, intraocular, biliary, peritoneal, pleural, and synovial fluids. The principal electrolytes, sodium, chloride, and bicarbonate. Others are potassium, calcium, and magnesium. Plasma and interstitial fluid. There are two major compartments of these extracellular fluids. They contain the same electrolytes and solutes with the exception of protein. Plasma is protein rich, containing large amounts of albumin. Your interstitial fluid contains little or no protein but carries nutrients to and waste products from cells. And so this is just showing you again the intracellular fluid versus extracellular And you can see intracellular is about 40% of the body weight and the extracellular is about 20%. And so this is just kind of showing you intracellular are found within the cells, extracellular are found outside the cells, your interstitial is between the cells, transcellular is your cerebral spinal fluid, saliva, tears, gastrointestinal tract. And here again, it's just showing you the breakdown. All right, salt does break into electrically charged ions in water, and they can break down into sodium and chloride. And again, just reiterating that cations are positively charged, anions are negatively charged particles. Electrolytes are measured in milliequivalents per liter. Maintaining balance of fluid volumes and electrolyte compositions is essential to health. And again, here's your intracellular found within the cells, about 2/3 of the total body fluid in adults. It is vital to normal cell functioning and contains solutes such as oxygen, electrolytes, and glucose. All right, extracellular, these are found outside the cells. It's about 1/3 of the body weight. Two major compartments, intravascular, interstitial. Third compartment, lymph and transcellular, which we talked about, and your principal electrons are sodium, calcium, and bicarbonate. Looking at movement of body fluids. Movement of body fluids across cell and capillary membranes are accomplished by several different methods. And these membranes are completely permeable to water but are selectively permeable to solutes, which are small particles. This is your ions, oxygen and carbon dioxide, that move easily across. Large particles like glucose and proteins have more difficulty. Electrolytes and solutes move by osmosis, diffusion, filtration, active transport. All right, looking at osmosis. This is the movement of water across cell membranes from less concentrated solution to more concentrated solutions. So water moves trying to equalize these concentrations. Solutes can be crystalloids or colloids. Your crystalloids are salts that dissolve readily into true solutions. Your colloids are substances like large protein molecules that don't readily dissolve into a true solution. Your solvents are a compound of solution that can dissolve a solute. So looking at solutes and solvents, example would be sugar, which is your solute, added to coffee, which is the solvent, and that is how they are mixed. In the body, water is the solvent, and electrolytes, oxygen, carbon dioxide, glucose, urea, amino acids, and proteins are your solutes. All right, osmolarity. As concentration of solutes is greatest, determinant of osmolarity in extracellular fluid is your sodium, glucose, and urea. The greatest determinants of osmolarity in intracellular fluid is your potassium, glucose, and urea. All right, so tonicity is osmolarity of a solution. So you have your isotonic solution is the same osmolarity as your body fluids, and remember that's your example is like normal saline. Your hypertonic solutions have a higher osmolarity than body fluids. So an example of that could be 3% sodium chloride. Your hypotonic solutions have lower osmolarity than the bodies, and again, your example of that is half normal saline. All right, so osmotic pressure is the power of a solution to draw water across a cell, across a membrane. Your colloid osmotic pressure is also called oncotic pressure. Is plasma proteins pull water from interstitial spaces into the vascular compartment. This is important in maintaining their vascular volume. And so this is an example of osmosis, and you see your semipermeable membrane. You can see before osmosis and after, and remember it's the water that is moving to make the concentration the same. All right, so osmosis can be demonstrated by the mechanism of thirst. So when you lose water, like sweating, exercise, diuretic abuse, the extracellular volume is decreased, then a message is sent to the hypothalamus. This message creates thirst, and you drink fluids. When enough fluids is consumed and the extracellular fluid volume has been replaced, the message is no longer sent to the brain and you stop drinking. And I learned in school a lot through osmosis, carrying my stuff around everywhere. So, all right, so diffusion is an intermingling of molecules. It is a continual intermingling of molecules in liquids, gases, or solids that are brought about by a random movement of these molecules. Diffusion occurs when two substances are separated by a thin membrane. Large molecules move less quickly than smaller ones because they require more energy to move about. In diffusion, molecules move from a solution of higher concentration to a solution of lower concentration. It increases in temperature will also increase the rate of diffusion. And so this is an example of diffusion. And so the solids are now evenly distributed in the liquid. All right, looking at filtration. This is movement of fluid and solutes together across a membrane from one compartment to another. It moves from an area of higher pressure to lower pressure. When your hydrostatic pressure is greater than the osmotic pressure, the fluid will filter out of the blood vessels, which can lead to edema. So this hydrostatic pressure is pressure a fluid exerts on the walls in a closed system. All right, looking at active transport. Substances move across membranes from less concentrated solution to more concentrated solution. Metabolic energy used is what differs this from osmosis and diffusion. In active transport, a substance combines with a carrier on the outside surface of this cell membrane, and together they move inside the cell where they separate. Each substance requires a specific carrier. Active transport is very important in maintaining the difference in sodium and potassium ion concentration of extracellular and intracellular fluids. Sodium is higher in extracellular and your potassium is higher in cells. And so usually when sodium moves into the cells, then potassium has to move out. And so that is your sodium-potassium pump that is working in that aspect. And so here is a picture of your sodium-potassium pump. All right, so by active transport, sodium moves out of the cell and potassium moves into the cell to maintain this concentration difference. The energy source for this active transport is ATP, which is produced in the cell's mitochondria. All right, regulating body fluids. Your body needs about 2,500 milliliters a day, but usually people only drink about 1,500 milliliters today. The added volume is acquired from foods, which is relatively high in fluid. Your hypothalamus stimulates the thirst center to make us drink when we need it. Fluid output, bladder is the major avenue for your fluid output. About 1,400 to 1,500 milliliters a day is excreted in urine. And so it needs to be at least 0.5 milligrams per kilogram per hour. Milliliters per kilogram per hour. Skin may be noticeable or not as far as these insensible losses that are through the skin. So if it's noticeable, it may be through sweating. Sometimes it's not noticeable. Breathing causes losses about 300 to 400 milliliters a day. And then you also lose fluid through feces. So this is looking at your sensible losses versus insensible. And so most of your sensible are going to be urine, feces, and wounds. These can be measured and the patient is aware of them. So your insensible losses are sweat, lungs through respirations. These cannot be measured, and usually the patient is not aware. So urine is about 1,500 milliliters, feces about 200, sweat 600, lungs 300 to 350 milliliters. All right, so calculation of fluid loss or gain. So 1 liter of water weighs 2.2 pounds or 1 kilogram. So if they have lost a kilogram in weight, they have lost a liter of fluids, and vice versa. So body weight is a good indicator of overall fluid volume loss or gain. So you want to make sure that you're weighing your patients at the same time, on the same scale, with the same clothing each day. All right, regulating body fluids, maintaining homeostasis. Your kidneys are the primary regulator of body fluids and electrolyte balance. As kidneys regulate and filter waste, they return electrolytes like sodium and potassium to blood for use. Your antidiuretic hormone helps to regulate water excretion from the kidneys. Your renin-angiotensin-aldosterone system is a specialized receptors in the kidneys that respond to changes in renal perfusion. So this initiates the renin-angiotensin-aldosterone system. So if blood flow or pressure to the kidneys is decreased, then renin is released, which ultimately promotes vasoconstriction and promotes sodium and water retention. The net effect of renin-angiotensin is to restore blood volume and renal perfusion through sodium and water retention. Your atrial natriuretic factor is released from cells in the atrium of the heart in response to excess blood volume. Your atrial natriuretic factor promotes sodium wasting and acts as a potent diuretic, thus reducing vascular volume. It also inhibits thirst, reducing fluid intake. Electrolytes are important in maintaining fluid balance, contributing to acid-base regulation, facilitating enzyme reactions, and transmitting neuromuscular reactions. So we're going to talk about sodium. Normal sodium level is 135 to 145 milliequivalents per liter. It is your most abundant cation in extracellular fluid. It does contribute to serum osmolality. Sodium functions largely in controlling and regulating water balance. When sodium is reabsorbed from the kidney tubules, chloride and water are also reabsorbed with it, thus maintaining extracellular fluid volume, because sodium and chloride and water all kind of follow each other. All right, so these are your sources of sodium, obviously table salt, seasoning, and spicing. Your processed foods, hot dogs, cold cuts, ham, beef jerky, canned soup, bacon, all kinds of your chips and crackers, soda beverages are high in sodium, pickles and other pickled foods, your sardines and herring, potatoes and other white vegetables are actually high in sodium as well. So a lot of times you have to do a lot of education for your patients because they are unaware of these hidden sources of sodium. All right, so potassium, the normal potassium level is 3.5 to 5.3 milliequivalents per liter. Some of these normal levels are going to be different according to different textbooks you read. Some textbooks will say 3.5 to 5.5. Also, your normal levels will differ in the hospital setting according to different hospitals you work at, but usually they're pretty close within a couple of tenths of each other. Potassium is the major cation in intracellular fluid. It helps maintain the intracellular fluid osmolality. It transmits nerve and other electrical impulse. It is vital for skeletal, cardiac, smooth muscle function. It does regulate acid-base balance and has to be ingested daily because the body doesn't conserve it. So these are your sources of potassium. And so everybody always knows about the bananas, but it is found in some of your other fruits, as listed here. Dark green leafy vegetables, your salt substitutes, all brand cereals, potatoes, dried beef, beef jerky, deer meat, nuts, cocoa and brewed coffee. And so this is showing you also some of your foods in picture form. So looking at calcium, normal calcium serum levels are 9 to 11 milligrams per deciliter. 99% is found in the skeletal system. It is a cation. It is vital in regulating muscle contraction and relaxation, neuromuscular function, and cardiac function. It also aids in blood clotting and activating enzymes. Here are your sources of calcium. And so everybody is quite aware of dairy products, which probably has the most calcium in it. But you've also got some in your fortified juices that are labeled fortified. Dark green leafy vegetables like your spinach, kale, rhubarb, collard greens, broccoli, your canned salmons and sardines and oysters as well. All right, so these are some other foods that are high in calcium. All right, magnesium. Your normal magnesium level is 1.5 to 2.5 milliequivalents per liter. It is found in the skeletal system in the intracellular fluids. It is the second most abundant intercellular fluid cation. It helps and is important in intracellular metabolism. It also helps with protein and DNA synthesis, operates the sodium-potassium pump, regulates cardiac neuromuscular function. It also aids in relaxing muscle contractions. Your sources of magnesium, vegetables are probably your best source. We've got those listed here. You've also got your whole grains, nuts, and seeds. Commonly found in tap water because it's a mineral. It's also found in dried fruits, tuna, pork, and chicken, and Reese's cups. So it is actually found in dark chocolate. There is a direct relationship that exists between magnesium, potassium, and calcium, and so you can see when we were talking about what they do, how a lot of them are kind of similar. And so this is important because only 1% of magnesium is found in the extracellular fluids. All right, looking at chloride, normal serum levels are 95 to 105 milliequivalents per liter. It is a major anion of extracellular fluids. It works with sodium to help regulate serum osmolality and blood volume, regulates your extracellular fluid balance, regulates acid-base balance. It is a major component of stomach fluids and stomach acids. It is a buffer in the oxygen-carbon dioxide exchange system. Chloride follows sodium and it is found in the same foods as sodium. All right, phosphate, normal serum level is 2.4 to 4.5 milligrams per deciliter in adults. It is much higher in children. That of a newborn is nearly twice that of adult. It is a major anion in extracellular fluid. It helps form bones and teeth. It also helps with metabolisms of proteins, fats, and carbohydrates. Phosphate is involved in many chemical actions as well. It is essential for functioning of muscles, nerves, and red blood cells. It also helps regulate calcium levels. These are your sources of phosphorus. In addition, you've got your legumes and poultry. Your fruits and vegetables are low in phosphorus, especially your spinach, rhubarb, bran, and whole grains. And so this is again just showing you other sources of phosphorus. And there's you some pictures of foods that are high in phosphorus as well. And then it's also talking about tips that can help with phosphorus, talking about taking medications, making sure that they take them as directed and that kind of thing as well. All right, bicarbonate is found in both intracellular and extracellular fluids. It is a major body buffer. Primary function is in regulating acid-base balance. Bicarb is produced through metabolic processes in adequate amounts to meet the body's needs. All right, looking at genetic and lifespan consideration, pediatric differences. Infants lose more fluid through their kidneys because their kidneys are immature and less able to conserve water. Infants' respirations are also more rapid, so their body surface area is proportionately greater than adults. So they will have an increase in insensible fluid losses from their skin as well as their lungs. The percentage of body weight that is fluid varies with age, which we've already talked about. Infants and children less than 2 years of age lose greater proportion of fluid per day than adults, so they are more dependent on adequate intake. Your respiratory metabolic rates are higher during early childhood, leading to more water loss. And because of this, the exercising child dehydrates easily and must consume more fluid during physical activity, particularly in hot weather. The kidneys are immature in children less than 2 years of age, so they cannot conserve, excrete water and solutes effectively. Infants and young children dehydrate or develop electrolyte imbalances very quickly, so that is something that you need to be aware of. Older adults, often their thirst response is blunted. Nephrons become less able to conserve water in response to the antidiuretic hormones, and these are nephrons that are found in your kidneys. And so this may be in spite of normal ADH levels. They're just not working as well. All right, dehydration risk increases. Which can also be a factor for hypertension, as well as the increased sensitivity to salt, which also is a contributor for hypertension. So salt sensitivity is defined as a rise in blood pressure when salt is consumed and a drop in blood pressure when salt is restricted. So when combined with an increased likelihood of heart disease, impaired renal function, and multiple drug regimens, the risk for fluid and electrolyte imbalance is significant in older adults. All right, looking at gender and body size, individuals with higher percentage of body fat have less body fluid, which we talked about. That fat cells contain very little water content, but your lean tissue has higher water content. And women have proportionately more body fat than men, so they usually have less body fluid than men. Men tend to have more lean tissue. All right, and so this is a breakdown again, just showing the difference between an adult man, about 60%, and so an adult woman is about 52%. So water accounts for only 30 to 40% of an obese individual's body weight. All right, ethnicity. Suggested sodium intake is about 1,500 to 2,300 milligrams per day. Average sodium intake in the United States is greater than 3,400 milligrams per day, so we get a lot more than we're supposed to. African Americans have a greater sensitivity to sodium, so hypertension is a huge risk for them, and they may also need higher doses of antihypertensive medications. All right, so concepts related to fluid and electrolyte balance. Elimination could be from diarrhea, which ends up with fluid and electrolyte loss. So you need to be alert for symptoms of sodium and chloride loss and assess for dehydration. Cellular regulation could be from blood loss, like hemorrhage, which would cause them to be in a hypovolemic state. Symptoms of that would be fatigue, tachycardia, low hemoglobin, and hematocrit. Cognition is mental status assessment. They have changes in electrolytes, increased or decreased electrolytes, leads to changes in their cognition. Thermoregulation, this could be hyper or hypothermia. Fluid loss leads to alterations in thermoregulation, so body loses ability to regulate heat. So you need to replace fluids, move them to the shade, or put them in air conditioning if they get overheated. Perfusion. Fluid loss leads to decreased perfusion. So you want to assess pulses, nail beds, color, their orientation, their body position for comfort, because that could affect their breathing. Give oxygen as ordered. May need medications to help improve their cardiac output. All right, in your assessment, you need to make sure that you're including vital signs, intake and output, daily weight, skin turgor, and mentation. Looking at alterations and manifestations. In fluid volume deficit, this is also dehydration. They have dry tinning skin, dry mucous membranes, increased hematocrit and hemoglobin, thirst, decreased urinary output, and weight loss. In fluid volume excess, they'll have edema. It could be even pitting edema, weight gain, ascites, which is extra fluid around the abdomen, increased CVP, which is your coronary venous pressure, adventitious lung sounds, elevated electrolyte levels, increased potassium causes fatigue, nausea, muscle weakness, cardiac irregularities. Increased sodium causes swelling, irritability, muscle spasms, thirst, confusion, and coma. Increased calcium can cause nausea, vomiting, excessive thirst, frequent urination, constipation, and muscle pain. Low electrolyte levels. Decreased potassium is the most critical one. It is most common from diuretics, unless it is a potassium-sparing diuretic. Chronic kidney disease can cause confusion and fluid retention. Acute renal failure can cause oliguria, fluid and electrolyte imbalances, fluid retention, drowsiness, dyspnea, fatigue, confusion, and nausea. Looking at compensation, the body is continually attempting to compensate for a fluid and electrolyte imbalance by shifting fluids and electrolytes from one component to another. It is rare for only one type of imbalance to occur. Usually it's more than one electrolyte is basically what they're saying. Prevalence. Disorders of diabetes and hypertension associated with hyponatremia, hypomagnesemia, and hypokalemia. Use of diuretics can cause electrolyte imbalances. Also, benzodiazepines are also associated with electrolyte imbalances. Looking at prevention, some of your modifiable risk factors Stress can increase cellular metabolism, blood glucose concentration, and catecholamine levels. Stress can increase the production of your antidiuretic hormone, which will decrease urine production. Diuretics and antipsychotic agents, they will be at risk for alterations in fluid intake due to the effects of the thirst mechanisms. Vasoconstrictors, beta blockers, some of your stimulants can also impair thermoregulation process, which increases the risk of fluid imbalance. All right, looking at heat-related illness. Prevention in warm temperatures is important, so they need to limit outdoor activity during the hottest part of the day. Take frequent breaks for rest and water. Drink water before beginning to feel thirsty. Wear lightweight clothes. Work or exercise with others when engaging in activity outside. And that way, if something happens, there will be somebody else there that can call for help or get them out of the heat. All right, assessment. Components of the assessment include the nursing history and physical assessment of the client, clinical measurements, and review of their laboratory test results. All right, so as far as the nursing history, you want to identify patients that are at risk for fluid and electrolyte balances. You want to get a current and past medical history. Get their current medications they're on, especially their diuretics. Looking at information on functional, developmental, and socioeconomic factors as well. Age, your older and young children depend on others to meet their food and fluid needs, so that can often play a role on their intake and output. A lot of times your lifestyle as well as your intake and output, you want to make sure that you collect information about their normal food and fluid intake. Look at their fluid output, any signs and symptoms of alterations in fluid and electrolyte balances. When you're looking at their history, that can reveal conditions like chronic cardiac disease, diabetes that can disrupt normal balances. Physical assessment. This is done to evaluate fluid and electrolyte status. So you want to assess their skin, oral cavity, mucous membranes, looking at their eyes because you're looking for periorbital edema or sunken eyes. Could be dehydration. You want to also assess their cardiovascular, respiratory systems, as well as neurologic and muscular status, and then looking at their overall appearance. Clinical measures is important to get daily weights. This provides a relatively accurate assessment of the patient's fluid status. And remember, each kilogram gained or lost equals 1 liter of fluid gained or lost. Vital signs and fluid and electrolyte and acid-base balance are important. Any changes in those, like tachycardia, could be an early sign of hypovolemia. Blood pressure is sensitive in detecting blood volume changes. Example, decrease with fluid volume deficit or hypovolemia. They will also have an increase in blood pressure with fluid volume excess. Postural orthostatic and hypotension could be from fluid volume deficits or hypovolemia. Intake and output during 24-hour period is important about fluid and electrolyte balance, seeing if they are equal. All right, fluid intake could be from oral fluids, ice chips, liquid foods, foods that become liquid at room temperature like Jell-O, tube feedings, your parenteral fluids, and IV medications. It also includes when you have to dilute IV medications, that should be included as well. Any catheter or tube irrigants. Fluid output is from urine, vomitus, liquid feces, tube drainage, whether that be gastric or intestinal, intestinal wound drainage. It could be also from draining fistulas. Diagnostic test, looking at serum electrolytes. Most common ordered electrolyte tests are going to be sodium, potassium, chloride, magnesium, and bicarbonate. Looking at your complete blood count, your hematocrit is affected by changes in plasma volume. It does measure the percent of whole blood that is composed of red blood cells. Your hematocrit is increased with severe dehydration and decreased with severe overhydration. Your serum osmolality measures solutes concentration of the blood. It is used primarily to evaluate fluid balance. Your urine osmolality measures solute concentration of urine. Increased urine osmolality is found in fluid volume deficit. An increase is found in fluid volume excess. Urine specific gravity is an indicator of urine concentration. Independent interventions, monitoring intake and output, weighing the client daily, engaging the client in plan of care, especially with meal planning, providing client education as indicated. This can include medications, their side effects, and prevention measures. Collaborative interventions could be initiating intravenous therapy, their IV management, monitoring fluid balance, medication administration, and blood transfusions. Collaborative as far as pharmacologic therapy, electrolyte correction to restore balance. Increased potassium treatment is glucose, insulin, or dialysis. Decreased potassium, side effects to diuretics, so you want to replace orally or IV depending on how low your potassium level is. Your increased sodium level treatment is to administer antidiuretic hormone. Decreased sodium level treatment is oral supplements, or if it's severe or life-threatening, they can do it intravenously. Your colloids are going to be your albumin, dextran 40. Crystalloids could be 5% dextrose and water, 5% dextrose and half normal saline. Sometimes they'll use normal saline and lactated ringers as well. Your diuretics, furosemide, hydrochlorothiazide, and spironolactone. So that is the end of the concept of fluid electrolytes. And as always, if you have questions, let me know and I will try to help clarify.